Trachoma. What exactly is trachoma and where does it come from? Trachoma is a very serious infectious disease that is the leading cause of the world's preventable blindness and one of the oldest diseases known to man. Trachoma is an infection of the eye that can ultimately progress to corneal scarring and blindness in adulthood. It is common in children, but often goes away after a few months. However, after years of repeated infection due to inadequate sanitation, the inside of the eyelid may become scarred so severely that the eyelid turns inward and the lashes rub on the eyeball, which scars the cornea. If untreated, this condition leads to the formation of irreversible corneal opacities and blindness. This disease is caused by the bacteria Chlamydia trachomatis. Chlamydia trachomatis is a small, gram-negative bacterium that is an aerobic obligate intracellular parasite which depends on its host cell for replication and as an ATP energy source. It can be either coccoid or rod-shaped and has an incubation period of 5 to 12 days in its host cell. It is found in two forms, the spore-like elementary body and the replicating reticulate body. However, the infectious form is the EB form, which lies outside the cell. Both forms work together in order to infect their host cell. After the metabolically inactive EBs attach to the cell, they then penetrate into the host cell and reassemble into metabolically active and replicative RBs, which is known as the second life cycle. These RBs divide in a large cytoplasmic inclusion, and that is the way that they replicate. The RBs then reassemble themselves into infectious and spore-like EBs that are released by host cell lysis or extrusion. C. trachomatis can be divided into serotypes or serovars. These serovars are a group of closely related microorganisms distinguished by a characteristic set of antigens. Some serovars produce almost exclusively ocular trachoma in endemic countries, while other serovars are associated with both ocular trachoma and genital tract infections. Infections with the ocular serotypes of C. trachomatis result in a mild inflammation of the subtarsal conjunctiva lining, which is the inner eyelid surface. Single infections usually clear without any permanent damage. However, with repeated infections, a chronic condition of conjunctivitis can result. This leads to the formation of subepithelial follicles that are visible upon inspection of the inner lining of the upper eyelid. Both the upper and lower conjunctivae have a follicular hypertrophy. A hypertrophy is an enlargement of an organ or tissue, but the reaction is most apparent in the upper conjunctiva and the edge of the cornea that also develops scarring. How is it spread? This disease is spread mainly through discharge of the eye from an infected person, but it can also be spread by flies that land on a person's eyes. It is a disease that is spread from person to person and is often spread from child to child or child to mother. The most common vector of the disease is Musca sorbens, which is known as the bazaar fly. Musca domestica, the common housefly, may also have a role in transmission, and Musca vetitissima, the bush fly, plays a role only in trachoma present in Australia. All three of these fly species exhibit eye-seeking behavior and are known to feed on eye secretions and nasal exudates, which consistently contain Chlamydia trachomatis elementary bodies. Women are 3 times more likely than men to become infected with trachoma because they spend more time with children. Wind, dust, and smoke worsen the pain of trachoma, making household chores such as cooking over an open fire or gathering wood from a dry field excruciatingly painful. The disease is linked to extreme poverty and to places where there is poor sanitation. This is due to the fact that there is not an adequate clean water supply where people can wash their hands and faces frequently. Symptoms. Symptoms of trachoma in children in the early stages are similar to the irritation of pink eye. There is itching of the eyes and eyelids and also a discharge from the eyes. As the disease progresses, one may feel eye pain, blurred vision, and sensitivity to light. Also, swelling of lymph nodes just in front of the ears, swollen eyelids, turned eyelashes, and cloudy corneas are symptoms of trachoma. The World Health Organization has developed a trachoma grading system. This system consists of 5 steps. The first step is follicular inflammation. The infection is just beginning in this stage. There are 5 or more follicles that are visible with magnification on the inner surface of the upper eyelid. The second step is intense inflammation. In this stage, the eye is highly infectious and becomes irritated with a thickening or swelling of the upper eyelid. The third step is eyelid scarring. This occurs after repeated infections of the inner eyelid. The scars often appear as white lines when examined and may become distorted or turned in. The fourth stage is ingrown eyelashes. Here, the scarred inner lining of the eyelid continues to deform, causing the lashes to turn in so that they rub on and scratch the transparent outer surface of the eye. The last step is corneal clouding. Here, the cornea becomes affected by the inflammation that is most commonly seen under the upper eyelid. Continual inflammation compounded by scratching from the intern lashes leads to clouding of the cornea. Secondary infection can lead to development of ulcers on the cornea and eventually partial or complete blindness. Virulence factors. C. trachomatis has a unique cell wall structure which enables it to inhibit phagolysosome fusion with phagocytes. It has been discovered that Chlamydia trachomatis has a small needle-like projection called a type 3 secretion apparatus that serves as a canal from the bacteria to the cytoplasm of the host cell. This means that it can inject proteins directly into the cytoplasm of the cell to avoid lysosomes. Treatment and prevention. Infections can be either self-limiting or progressive. During the early stages of trachoma, antibiotic eye creams will fight the disease. Creams that are commonly used are a tetracycline eye ointment and oral azithromycin, which is known as Zithromax. For the further stages of trachoma, the only true option is surgery to rotate the eyelashes away from the cornea. The only way to truly prevent this disease is through clean living conditions and good hygiene. It is important to always keep your hands and face clean, control flies, have proper waste management, and access to clean water. The World Health Organization has created a strategy to get rid of the disease, and this is known as the SAFE strategy. S stands for surgery to correct the advanced blinding stage of the disease. A stands for antibiotics used to treat active infection. F refers to facial cleanliness. And E refers to environmental improvements in the areas of water and sanitation to reduce disease transmission. It has been said by the World Health Organization that global elimination of trachoma as a disease of public health importance has been targeted by WHO for 2020. Statistics. Today it is believed that trachoma is endemic in 53 countries, and best estimates suggest that close to 110 million people live in these confirmed endemic areas, but 210 million people live in areas where trachoma is only suspected. According to the World Health Organization, it is estimated that more than 500 million people are still at high risk of getting this infection. Over 140 million people are currently infected, and about 6 million people are blind in Africa, the Middle East, Central and Southeast Asia, and countries in Latin America. It can be seen from the maps that although trachoma is present in all of these places, it is most present and has the biggest impact on the people in Africa, specifically East Africa. One person every 4 minutes experiences severe sight loss due to trachoma, and 4 people go blind every hour due to this disease. This disease is extremely serious and impacts people all around the world. Through organizations such as the Helen Keller Institute, the International Coalition for Trachoma Control, Orbis, and the Carter Center, we as a people can combat this disease by the predicted 2020.